Hi, guys, and welcome back to Child Life Services, working with children of adults patients. This is the part 2 of our presentation. My name is Sammy. So, in this part of the presentation, we will talking about how having a parent in the hospital affects each person involved, because it's not just the parent, it's not just the child. It includes the parent who's that patient, it includes the children and any siblings or anybody in their family, and it also includes the multidisciplinary team. Specifically, while being in the hospital, parents really have a hard time just maintaining their role as a parent. A lot of hospitals will not allow visits for children in the ICU or in the inpatient areas just because it is such a serious matter and they don't really want children running around. So that's a huge thing right now that really affects patients with their families. Parents really struggle, as we've talked about before, parents really struggle with just figuring out a way to talk to the child about the illness. And specifically, if there is a possibility where death could occur, parents are really not sure how to talk to them about that. Um, and in addition to this, not just the patient and the parent that are in the hospital, but the opposite parent as well. They are having to figure out how to learn to take on all the roles that the parent in the hospital usually do for their family, while also kind of dealing with their emotional difficulties. So they're taking on the roles of the other parent, they're taking on the roles of what they had done before, and they're also trying to deal with any emotional stress that they may be facing. So this really just affects, I mean, it's all about family centered care at this point. It really affects everyone in the family, not just the patient and the parent. Specifically with the children, they will, when their parent are in a hospital, they will face the disruption of the normal routine, which we all know is huge for children. Children love their routines. So when this is interrupted, it can cause some major issues for the kids. There's changes in their discipline levels. There's changes in the level of support from the parent. The parent, because they're sick, they may not be able to really do as much as they used to when they were healthy. The child will experience that anxiety and confusion about what this illness is, what will happen, is their parent dying, just really the unknown of everything that is happening. Um, and as everybody knows, children will experience that developmental regression while they're in the hospital, even if they aren't the patient. When their parent is the patient, they'll experience lower mood, sleep problems, poor concentration, difficulty in school, etc. There are just so many things that children go through while their parent is in the hospital. In addition to the family, the multidisciplinary team is also affected when a parent is in the hospital, just because they're really trained to focus on the medical needs. They're not trained to focus on the family needs. They're not trained to focus on psychosocial needs. So just staff are just not really prepared to support the needs of the patient's child. And it causes an increased stress due to discussions on having to talk to the children, because they don't have a lot of experience with that. They're more focused on medical things and the physical well-being of their patient versus the children at home. And even education and social work major professionals don't even feel equipped for the job of talking to children. So this is just why it just really shows that child life specialists in this situation is huge to be included in, just because obviously none of the multidisciplinary team, they're not very equipped. So this is why this is very important to talk about. So we'll go into how to really fix this gap in education. A lot of the recommended interventions would be educating staff about child life, which we have talked about before, but just kind of teaching them what is developmental theory, how can they learn how to communicate with children, just learning these skills on how to be able to talk to the children, and just in child life in general. If they're confused and they don't know what to do, being able to know that child life is there as a resource is very important. Secondly, educating these families, providing written and multimedia information for parents and children, just encouraging that role play, and recommending that they contact the schools and the therapists, just so they're aware that this is happening with the kids and they can help support them while they're at school, while their parents are in the hospital. And lastly, changing the environment of the hospital. As I said, a lot of times the kids aren't able to visit their parents. If they are in the ICU, it may be different if they were prepared for the visit or anything like that, but just making sure that like the kids are able to visit the ICU, because this is just huge and it disrupts the family life. And creating a safe place for children to play in the ICU area. I know it is like a scary area, and it comes off as like very intimidating for the kids. So reducing any unneeded medical equipment, just making this environment a safe place for families and children if they are able to go into that. So these are our citations on that. Thanks.